Well, as we have seen once again during this coronavirus pandemic, the focus has resurfaced on the cost of healthcare. And as always, drug prices are a part of that. We are joined now by someone who's trying to bring those drug prices down for some consumers. He's the GoodRX CEO. His name is Doug Hirsch. He's joining us from Los Angeles. And our Anjali Kamlani is with us as well. So your company basically, among other things, provides coupons for folks to get lower drug prices. What kind of uptick or not have you seen in business right now? I mean, a lot of people are, for example, are not doing elective surgeries, but I don't know how all of that has fed into your business.
Thanks for having me. Overall, there's been obviously much more attention paid on the healthcare system, and there's been much more attention specifically on coronavirus. I would say, unfortunately, for many Americans, especially people of color, there's been people have stopped going to the doctor and people have stopped going to the pharmacy. And so I think we have this sort of temporary crisis where people are just not getting the care that they deserve that they need because they are scared to go to the doctor. The good news is there are other solutions such as telehealth and home delivery. And there are ways for consumers to safely get their health care during the coronavirus. And I'm fortunate that our company is delivering a lot of those solutions.
Doug, Anjali here. I know that one of the things that I've seen is other companies that are doing similar type things, not exactly the same in terms of searching for savings for drugs, whether it be in mail order or even working with smaller distributors. They've seen, even in those cases, the cost of drugs rise as a result of some shortages. Have you run into that, and what can be done about that? Because that's something that I think we're going to be facing a little bit of in the future too.
The cost of drugs is obvious. I mean, that's what I spend my days doing, and that's what I've spent the last decade focusing on. We're not seeing any specifically coronavirus drug cost increases, with the exception of the shortages around things like when President Trump was talking about certain drugs, and the public responds by everyone tries to get a drug that may not have sufficient quantities, but that those tend to be somewhat temporary. What we focus on more is the patient out-of-pocket cost, which continues to be a disaster in this country, where consumers, with high deductibles or, God forbid, they've lost their job, simply are paying too much out-of-pocket on their behalf. Regardless of whatever the cost of the drug is, the consumer's share of that cost continues to go through the roof, which leads to consumers simply not taking their drugs. And that's the crisis that I think actually impacts America on the side of healthcare right now. And so I'm hoping that we can ultimately, for all Americans, make the cost something equitable that everybody can afford.
You've recently hired 2 individuals that are focusing on the growth of the company, a new CFO, a new president of healthcare. What can you tell us about really what you're looking at in terms of the future growth and expansion? You've already done a lot in the past year.
So we've been around for about a decade, and we spent most of the first, I'd say 8 years or so, focusing on trying to drive down the cost of prescriptions, specifically generic drugs, which make up about 90% of the drugs that are filled in this country every year. We're now focusing our attention on brand drugs, where, as everybody knows, you can have drugs that are $1 million. And there are lots of ways to work together with manufacturers and insurance companies and pharmacies to see what we can do to drive down the cost of those drugs. And as we mentioned earlier, we've really started focusing on the rest of healthcare. That's medical services, that's labs and tests, anything else that a consumer's spending money on. So we've recently launched a medical marketplace where we have 35 services and 150 conditions that a consumer can be treated directly from home. We also have acquired a company called Hey Doctor that's doing that. So you can actually use GoodRx today, see a doctor, get a prescription, have it sent to your house without leaving your couch.
You mentioned the out-of-pocket costs and trying to help people control those. I'm curious, even though your business is diversified, what happens if we get a change in political leadership after the presidential election and there is a move to very seriously control these costs, maybe even change the whole business model? What happens to your business?
I've spent the last decade trying to work with anyone who will work with me to solve this problem. And I think the reality is that it's a really, really complicated problem. And as much as I would love to pack up my bags and go home if the system could figure out a way to solve this problem, I think we're a long way away from a situation where Americans have no cost constraints on healthcare. I think no matter what political future we see, there's going to be hard decisions Americans are going to need to make. And we just want to be there to provide information and guidance for people who are going to have to navigate the system. And if anything, it seems like the trends are going away from sort of a Medicare for all to more of a free for all, where Americans have to figure out how to figure out strategies to afford the healthcare they need. So, anything goes in 2020 for sure. but we're going to be there to help Americans in whatever capacity they need it.
I just kind of want to touch on the effectiveness of telehealth. You know, I've used telehealth myself during COVID. My wife has used it. You know, it seems like it's fine for these times, but it's certainly not as I guess immediate or effective as an in-person doc's appointment. And you know, understanding how prescriptions work, you lose that sense of immediacy and connection. How, I guess, are you trying to make it easier for people who are trying to understand their prescriptions while using the services?
We don't propose telehealth being a solution for everything, and we certainly don't propose interrupting a relationship that you have with an existing physician. You know, if you have an ongoing relationship with a doctor, by all means, you should continue to do that. And many of those ongoing relationships are now happening via telehealth, where the doctor already knows you and already knows, you know, everything there is to know about your vital signs and information. For patients who don't have an ongoing relationship with a physician, which is sadly a huge number of Americans, or for something more, I'll call it mundane and low risk, such as, you know, I need a birth control refill, or, you know, we focus heavily on urgent conditions, but where a consumer can self-diagnose, like a UTI or erectile dysfunction, you know, where it's a relatively safe procedure. They can be talked to via telemedicine, and a prescription can be written that has limited side effects. Those are areas that we think are ripe for moving to telehealth. But we think the long-term vision of telehealth will be a great way to connect with a physician you already know. And for certain conditions, low-risk conditions, it's great to have the option to do telehealth when you cannot get to the doctor.
Doug, thanks very much. Doug Hirsch is the CEO of GoodRX. Appreciate it.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.